So as we have just gone through the overview, looking at the anatomy and then some aspect of the assessment of the skin. Now let us look at the basic conditions associated with the skin. So first we'll look at the bacterial infections of the skin. And so the session of the course will focus on bacterial skin infection, including impetigo, folliculitis, pseudofolliculitis, and then Folliculitis, and then cellulitis. So in addition, bacterial skin infections are also categorized as primary and then secondary infections. Bacterial infection of the skin, of the hair, and the nails are also discussed. So at the end of the session, the student will be able to define bacterial disease conditions associated with the integumentary system, identify bacterial infections of the skin and its appendages, manage patients with bacterial infections of the integumentary system. And so the key topics to be covered in the session are as follows. We have the impetigo and folliculitis, we have Carbuncles and then cellulitis, and then conditions of the hair and nail. So impetigo, a number of bacteria or flora normally inhabit the skin, and they most do not cause infection. But however, when the break in the skin that allows invasion by pathogenic bacteria, and infection called pyoedema may occur. And so the most common bacterial infections are caused by gram-positive Staphylococcus aureus and beta hemolytic streptococci. And bacterial infections of the skin may be primary or secondary. Primary infections are caused by a single pathogen and arise from a normal skin. And the secondary infection develop in the skin that is traumatized. And so a disease in this sense, whereby we are looking at the primary infection. And so in the secondary infection, what happened is that secondary infections arise from a pre-existing skin disorder in which several microorganisms may be implicated. So primary, we are referring to one particular pathogen affecting the lesion, and then the secondary, we have more than one organism. And pathophysiology, as we all know, bacterial infection of the skin arise from a hair follicle where a bacteria can accumulate and grow and cause a localized infection. And here, particular reference may be made to the fact that when we have poor hygienic practices of the client, that is a situation whereby microorganisms may be accumulated under the hair follicle, and then that can cause a lot of havoc and then disease conditions to the patient. However, the bacteria can invade deeper tissues and then cause systemic infection. Potentially, that can be life-threatening disorder. And these are various types of bacterial infections of the skin, including impetigo, folliculitis, and then cellulitis, which is a major condition in most cases. Some of the conditions can start as a small condition or a minor problem, but it can go on and then become a systemic condition because of the circulatory mechanism. So impetigo is a superficial infection of the skin caused by streptococci, or we can have staphylococcus, and then multiple bacteria. And then the lesion begins as a small red macule in which we can have discrete thin-walled vesicles that soon may be ruptured and then become covered with loosely adherent yellow crust, and it looks like honey. So now if I mention crust, you understand. So once the lesion ruptures, fluid and then some kind of blood may come to the surface of the skin, and then when wind blows over it, then it becomes very hard and then it rests on the skin, and that is the honey yellow crust. Yeah, so what happened is that in the mouth area here we have a lot of lesions, and what I mean by the crust, you can see the yellowish and then inflamed areas. We have a lot of crusts that are dried and then resting on the skin. We can have some of them here, and these are examples of impetigo that we are talking about. It can erupt at almost every part of the body, and may be common also in children. And here too, you can see on the skin. And these yellowish areas, at times it becomes very hard, and so if you make any attempt to remove, you can see some hyperemic areas. It will start bleeding. So in most cases, it's a matter of just cleaning around to avoid the spread of the condition to the other parts of the body which are not affected. And so cleaning around, at times pus may be collected under the crust, and then with time, when we do proper cleaning, it may not spread to other parts, and at times it can dry and heal, and then when it heals, it can remove by itself. But in some cases, with conscious technique, we can remove them and then expose the areas and then just remove the pus. And that is one of the technique of trying to treat this kind of condition. But the caution is that you don't need to force it to be removed. Other than that, it will bleed. But when they go out themselves, what happens is that they leave areas that are red, and then probably no pus may be identified. So the crusts are easily removed, and then reveal smooth, red, smooth, moisture surfaces on which the crust seem develop. And so this is an example of it. So impetigo is contagious and may spread to other parts of the body. And so it's very important that interventions are identified as soon as possible, that patients are diagnosed, and then we want to treat them. And so it can spread to other members of the family who may have contact with the patient or use towels or that are soiled with the exudates of the lesions. Although we've seen that in all ages, it's particularly common among children living in poor hygienic conditions, and in adults, ill health, poor hygiene, and then malnutrition may also predispose them to this kind of condition. Management, systemic antibiotics, very important. For instance, we have chlorhexidine, dechlorhexidine, and then in some severe cases we have cephalosporins, which are also very effective, and it's used to reduce contagious spread, treat deep infections, and then prevent acute glomerulonephritis. That's very, very important that you have to know. Cases of glomerulonephritis, which is a kidney problem, what happened is that in most cases, patients who might have contracted impetigo for some time back later develop glomerulonephritis, which is an acute form that affects the kidneys. And so it is very important that at the point where we are able to diagnose the patient with impetigo, we have to treat it vigorously with strong antibiotics. And that is why we are saying cephalosporins are also very effective in the treatment of these conditions in order to avoid later conditions of the kidney and then other possible organs. So it's very important that we treat it with all the efforts that we have in place. Antiseptic preparation, Provadin for just superficial application may be used to cleanse the skin in the vicinity of the skin of the infection to prevent spread, and the lesions are soaked or washed with soap solution or remove the central site of the bacterial growth in order to avoid spread. And then after the crusts are removed, topical medication, for instance, neomycin, bacitracin are also applied, and then topical treatment must be done several times a day. But most important that we have to discuss is that because it's very contagious, what we need to do is that we have to apply all precautionary measures to be able to avoid spread to other members of the family and then the community at large. We have folliculitis, and it's a bacterial infection of the hair follicle, and here most commonly caused by staphylococcus, and the infection begins as a follicle opening and extends down into the follicle. Examples we can see here on the screen. We have a lot of spots that are affected, and here usually where we have the hair follicles, and we have already defined that the microorganisms just settle around the hair follicle and just around, and so they can cause this kind of condition. We have pseudo-folliculitis, which is similar, also called Barber's itch. It's a medical term used to describe persistent itching caused by shaving. We all know, men when they shave, usually we have this kind of problems. And ingrown hair is curly hair that curves or twists on the surface and then re-enters the hair follicle, opening again, and that causes this kind of condition. We have the folliculitis. It's similar to what we have already done, and this is a superficial folliculitis of the beard area in men. caused by Staphylococcus aureus, which is a bacteria. It is often appears on the skin, around the nose, the mouth area, and when hair follicle that are damaged during shaving becomes infected, especially those who are nasal staph carriers. If somebody has catarrh, usually it happens in most cases. We look at the Folliculitis and then the Cellulitis. Follicles, often called boils, are also inflammation of the hair follicle. They often start as folliculitis, but the infection spreads down the hair shaft through the wall of the follicle and then into the dermis, and then the bacteria produces necrosis of the invaded tissues, followed in a few days by the characteristic pointing of a boil or abscess. So follicles may occur anywhere on the body, but most commonly in the areas subjected to irritation. We have pressure, friction, and the excessive perspiration, such as back of the neck, the axilla, which is the most important area that it can occur, and also at the buttocks. The constitutive organism is commonly Staphylococcus aureus, and the follicle is usually deep, firm, red, painful nodule from 1 to 5 cm in diameter, and frequently the infection progresses and involves the skin and the subcutaneous fatty tissue. And when it reaches subcutaneous fatty tissue, it causes severe tenderness and pain, and then surrounding cellulitis with substantial amount of purulent discharge or pus is likely to occur. And then one or more follicle may occur on any part of the body at of the body that has hair, and then folliculosis refers to the multiple or recurrent lesions. Contributing factors include poor hygiene, which we have already mentioned as a major factor for most of the bacterial skin infections. Trauma to the skin can also cause it. Areas of excessive moisture, including perspiration, and then systemic disease, such as patients with diabetes, can also have this kind of condition. Let us quickly look at the carbuncles, which is an abscess of the skin and the subcutaneous tissue, representing an extension of the follicle. So to some extent, we can say that carbuncles develop from follicle that has invaded several follicles, and then it is and is larger and more deeper seated than the follicle. The lesions begin as firm mass located in the subcutaneous tissue and the lower dermis, and this usually caused by Staphylococcus infection. And the skin, they appear most commonly in areas in which the skin is thick, the back of the neck, buttocks, and the other areas. Contributing factors, we have poor hygiene, trauma, and then areas of excessive moisture, as we have already noted. Now let us look at cellulitis. Cellulitis is one of the bacterial conditions of the skin, and most commonly we see them in the hospitals, in our wards, every day in and day out, and at times it's very difficult to treat. So it's a diffused acute staphylococcal or staphylococcal localized infection of the dermis and the subcutaneous tissue, and can occur following a wound or skin ulcer or an extension of follicle or carbuncle. And then cellulitis occurs most commonly in the lower extremities, usually beginning in an open wound. But in some cases, there may not be any wound, but the condition can occur. So it may occur in individuals with chronic conditions like diabetes, and so there is locally we have the infection that is spread as a result of the spreading factor, and then that is an enzyme, and the enzyme or the factor which is produced by the causative organism breaks down the fibrin network of the skin, and that serves as a barrier, and that normally localizes the infection. But the spreading factor is able to overcome this mechanism, and that is enzymes prevent the normal body response that would reduce the local spread of the infection, such as swelling of the site. And so the area of cellulitis is red, warm to touch, swollen, and painful, and in some cases vesicles may also form over the area of the cellulitis. Now when I say vesicles may be formed, you understand what is vesicle. Vesicles are lesions, clear lesions that are formed, and then with on the affected areas with clear fluid, And so initial stages, it may look like the person has a blister of the affected area, and so that may be the initial manifestation. And then in some cases you can also have patent edema or an orange peel appearance may be present, and in severe cases the affected part may contain lot of pus which needs to be removed. So in some cases we have to prepare the patient for incision and drainage in a mini theater, and that is done with packing, and then dressing of the wound is done subsequently, and that is very, very important. But in some cases this kind of wound after IND is done is deep, and so the number of packs, for instance the gauze that are used to pack, you need to be extra careful. You have to count them. Other than that, in some cases what happens is that some may be remained, and then the wound healing can occur, and then those that are under the wound may be covered with tissues, and that may be another problem in future. So the number of gauze that are used during packing, especially at the theater, they need to consider that number and then indicate it on the paper, the incision report, so that when later you begin to do dressing at the ward, you know the number of gauze that you have used to pack the wound. And then at the ward level, when you are dressing this kind of wound, you also need to do some kind of packing, and then you don't need to pack it very tight. Other than that, it's also a way of preventing fluid coming from the wound, so you have to lose it somehow, so allow fluid exudates also to come out, and then by and by the wound will become red. When you see redness forming, and then the pus and then sloughs are removed, then it's an indication that the wound is healing. So cellulitis, initially you have this kind of blisters that are formed, and then in severe cases it become you have patent edema, and then the orange peel appearance may also occur. And as I've already indicated, it can occur when there is abrasion and then it's infected. Usually it occurs in the lower extremities, especially the lower part of the leg. However, it can also occur at the other parts of the body, the hand, and then even in the face. And we have causative factors, and then we have also indicated that patients with chronic condition like diabetes, they can also have it. And so somebody with repeated number of attacks of cellulitis, we need to screen for chronic conditions like diabetes and then other factors. Treatment of cellulitis begin with identifying the infecting organism through tissue or blood culture, and then we have to use systemic antibiotics, commonly penicillin, to treat. We can also use erythromycin, which may be given, and then the pain associated with the condition, you have to give analgesics given as necessary, and then the affected extremity is immobilized, which means we don't have to move it, and then elevate it to improve venous return. So if it's a lower part of the body, for instance the leg, lower leg area, then we need to, when the patient sits down, we have to raise it in order to enhance venous return, and that is a way of reducing edema. Diagnosis of the bacterial skin infections is made by assessing the appearance of the lesion and by identifying the causative organism. So it is very important that we need to do, in some cases, take a specimen of pus or a specimen from the affected area, and then send it to the lab for investigation to be able to identify a specific organism in order to treat. Now we said that diagnostic investigations are very important, and so for most of these conditions, if we have our own way out, we need to do culture and then sensitivity test to of the drainage from the lesion, and may be conducted to identify the organism and to target the most effective antibiotics. And then if the infection is systemic, a blood culture may be conducted to identify a causative organism. In the treatment of Staphylococcus infection, one most important thing is that we are not supposed to rupture or destroy the protective wall of the induration that has localized the infection. So if it starts as a boil or an abscess, we don't need to squeeze it. So swelling should be left, and if, for instance, a boil or even a common pimple is found on the face, we should never squeeze it. If we do that, what happens is that we spread the microorganism which may be causing the problem, so that other parts of the body may also be involved. So squeezing and then using pressure on the lesion may be avoided, and that is one of the contra indications or factors that we have to take into consideration as part of our treatment. Management against systemic antibiotics, and that is very good, and we also have topical antibiotics may be used, and here we have miprocin or neoprocin, and then to be applied 2 or 3 times daily, and may be treated with chlorhexidine or even penicillin. And then the cephalosporins are reserved for serious conditions. Let me also tell you that in some cases, patients with cellulitis, some of them are severely ill, and so even when they come to the hospital and then they need admission, at times we need to admit them, and then we treat them as such. Even in the initial stages, some of them are very weak, especially the elderly. They may not be able to eat, and so we have to give them some kind of IV fluids to sustain them for some time. And then where they are also having other chronic conditions like diabetes, we should be extra careful to be able to treat that. So as I've already indicated, intravenous infusion indicated for very ill patients, and then toxic patients. What I mean by toxic patients is those that are very sick, and then probably as a result of infection, probably we have done their blood culture sensitivity test and they are very weak, and these are the patients who are very toxic. Toxic children to be treated as such. So the surrounding skin is cleansed gently with antibacterial solution or soap, and then antibacterial ointment may be applied to prevent spillage and then seeding of the bacteria in the event that the lesion ruptures or is incised. And then as part of management, in some cases, bed rest is also advised for patients who have abscesses on the perineum or the anal region, and cause of systemic antibiotics therapy is indicated to control the spread of the condition. Nursing care focuses on bacteria spread to be able to prevent spread of the condition, and then restoring normal skin integrity, and then the nurse assess the client for any systemic infection which may also be manifested by fever, chills, and then malaise. And then local infection of the spread of the infection include increase in erythema, and then we need to make sure that patients who need to be hospitalized are hospitalized, and then commence treatment as soon as possible. And then we also try as much as possible to prevent cross-infection. And then they stress the importance of bathing daily with an antibacterial soap, and then we also need to cover drainage lesions with sterile dressing, and handle soiled lesions or linen and dressings according to the universal precautions. And then when changing dressing, always wear disposable rubber gloves and the masks to prevent contamination. Other nursing procedures you can take your time and then go through later. And the conditions of the nail and then hair, we have alopecia, which can result from nutritional problems, and then here we have defined it, and then it may occur due to drug therapy like gentamicin administration, propranolol for BP control, and then indomethacin, and then in some cases anti-cancer drugs such as cyclophosphamide, and then andromycin, and then vincristine can also cause it. And then we also have nutritional type, fungal, and then bacterial infections of the scalp, and then cancer of the scalp may also lead to alopecia in the individuals. Fever is likely cause this kind of prolonged fever, such as malaria, and patients with typhoid who have been hospitalized for a very long time. And then pressure areas on the area of the scalp for a long period of time is also likely to cause this kind of so it is due to reduced blood flow to the hair follicles in the region, whereby we are looking at the pressure as a major factor, and this may be temporal. Friction is also likely to cause this. So friction from tight hair bands, wigs, and then hats can sometimes cause a break of the hair. And so in infants, hair loss may occur as a rim along the back of the head due to friction from the pillowcase, and this is common. As parents and then as fathers, we might have seen some of these things when we give birth to children, when they have the hair, at times because of the pillow that they use with time, because of the friction and then the pressure, that may also lead to hair loss and therefore harmless, and it's also temporal. And as you can see on the screen, we can see now as it is here. And this is a typical example of the alopecia. And the types, we have male pattern baldness, and then is the most common cause of alopecia in men and believed to be caused by combination of factors including heredity. We have increasing age and then androgens and then other factors that we can think about. And then we also have the female pattern. And then other types, we have the alopecia areata. This type of alopecia is characterized by round or oval bald patches on the scalp as well as on the other hairy parts of the body. And then alopecia totalis, which is the loss of hair on the scalp, and this is a rare condition and it's irreversible. And then we have alopecia universalis, which is the total loss of hair on all parts of the body. I will ask you to go through Paronychia, which is the disorder of the nail. I have provided you with the nose, and here we have already mentioned that in some cases this is common among patients or clients who do a lot of washing with their hands, and this can be superimposed by other microorganisms, and these are common ones that you can see over here, and then at the tip of the. And then here too, you can see that it has started at the angle of the nail. And this is another one, another picture you can see here is localized around this place. And if time goes on, it will affect the nail. And then we have also Onychomycosis, which is the separation of the distal nail plate from the nail bed, and occurs most often in the fingernails. And this disorder may result from many different factors, including excessive or prolonged exposure to water, those who wash with detergents, alkalis, and other industrial agents, and then candida infection, and then nail hardening, especially in our ladies, is also likely to occur. And then prolonged application of false fingers may also cause this kind of disorder. As you can see on the screen, the nail is actually affected, and you can see the hyperamic areas. And then if at times it can affect the whole nail, and then with time it will be removed. We also have ingrown toenail, and it results when the angle of the nail plate grows into the soft tissue of the toe, and so pain and then infection may occur. And then infection, if untreated, may spread to the bone, and this may actually be very dangerous for the person or the client. And here, in some cases, it affects patients with chronic conditions like diabetes. As we can see here, what happens is that the nail can grow and then cut the tissue. It can grow, so ingrown toenail, and then when it cuts this tissue, then we have superimposition by microorganism, then it becomes infected. And so you can see from the screen that we have pus and then aspects of bleeding also taking place. And then the toenail can grow under the nail fold instead of continue growing to outward way, and then as it's supposed to be. So one of the technical way of preventing this, let me go back and show you. If it's going to grow and then cut the nail, one of the ways to prevent it probably to pack beneath with cotton or small amount of gauze, so that it will prevent the nail growing down to cut the nail. And when it grows straight without cutting the nail, then it can be cut with bleed or any other device without affecting the tissue. And that is one way of preventing it. These are minor conditions. And then we have the Onychomycosis, and this is a fungal infection of the nail plate, just like those that we have mentioned. And this one, we have different microorganisms that can cause it. And it's chronic fungal condition of the toenails, or less commonly fingernails. And it's usually caused by, we have Trichophyton species. We have the different types, and then also we can also have this condition caused by Candida albicans, and it's usually associated with long-standing fungal infection of the feet. We have already discussed this under fungal infection. And then so for collaborative care, the treatment of disorders of the nail vary from pharmacologic treatment to surgical removal. And so infection of the nails are treated depending on the causative organism with antifungal or antibiotic medication. And so nursing care of the client with a disorder of the nail focuses on teaching self-care, and clients with nail disorders that are caused by frequent exposure to water are educated to protect the hands or feet from any injury, and also to keep the nails as clean as possible. So we've come to the end of the second session, and then let us prepare for the third session.